Singer Glenn Campbell is just one of the 5 million Americans with Alzheimer's disease.
The incidence of the disease is rising in line with the aging population. And Dr. Zorba Paster joins us tonight from his clinic in Oregon. Hi, Zorba.
Hi, Zorba.
Good to see you.
Hi. Good to be here.
So Alzheimer's is obviously not a normal part of the aging process. So what's behind this rise?
Well, we're not exactly sure what causes Alzheimer's. We know that it's a protein that's deposited in the brain called amyloid, and it produces these things called plaques and tangles. Basically, it's a communication system that has gone awry. And the problem with Alzheimer's is because we don't know what really causes it, we don't have an idea of what we can do to prevent it, although there are some tips that may actually help people keep from getting it.
Tips like what?
Tips like keeping your mind energetic, crossword puzzles, reading, thinking, playing cards, stuff to actually use the mind. The second thing is an aspirin a day may help. There's evidence that Lipitor and simvastatin drugs to help prevent cholesterol can actually help reduce the risk of Alzheimer's. And then, of course, the other thing is keeping your blood pressure under keen control. Because not all memory loss is Alzheimer's, some of it is simply due to hardening of the arteries in the brain. Keeping your blood pressure under good control helps a lot with that.
Well, it's interesting you say that because a lot of people of getting to a certain age have intermittent memory loss. It happens to me all the time, and you think, uh-oh, should I? When do you know whether it's cause for concern?
Well, I'll tell you something. My mother had Alzheimer's disease, so it's something I always worry about. My partner, Dr. Balin, in the office is 20 years younger than I am. Every time he forgets something, I feel good because that means I don't have Alzheimer's disease. It's a very strange thing. But there's a normal part of aging. Our ability to hold phone numbers in our mind, remember people's names all the time, that's really normal aging. Alzheimer's is when you can't really make a decision. You don't remember to turn off the stove. You're looking at the stove. And sometimes in very early Alzheimer's, it's hard to determine, and that's where a visit to the doctor and sometimes psychological testing really does make a difference.
So at what point do you say, well, this is a problem? We saw Glenn Campbell. He doesn't even know what Alzheimer's is, but he knows all the lyrics to his songs.
Right. And the reality is, certain things that you've done all the time are things that you're going to be likely to remember. Learning new things, executive functions, the ability to make a decision, conversation, laughing at things, humor, those are all things that are higher level functioning. But once again, it's testing sometimes psychologically that you help find out if you have Alzheimer's. There is no blood test, there is no MRI test, there is no solid test that we know to really show when it's there.
Do the medications that are on the market now prolong the onset of Alzheimer's?
No, but they do reduce the time when people go into a nursing home. It's been shown that Aricept is really the major drug that's been on the market for a long time, soon to be generic. That when you take it on Alzheimer's, the time when you have to go to a nursing home or assisted living may be delayed by up to 1 to 2 years. That means that many people function better on this drug. It doesn't improve them, but it keeps them from actually worsening. And that's where I think these drugs really have a place.
As the population ages, good information. Zorba, thanks for being with us today.
Thanks, Zorba. Good to see you.
My pleasure.